So shall I go ahead with the first question?
Yes.
So when should chest pain be a concern?
Yes. So chest pain is often a concern these days, mainly because of the sudden increase in heart attacks, especially in people who are relatively young and supposedly in the prime of their health. So when such people are losing their lives, every chest pain becomes a concern. So as a doctor, we are ultimately responsible. So we will rule out cardiac disease by various tests, blood tests, and imaging modalities. But to speak specifically about chest pain, the most common reason for chest pain, and especially left-sided chest pain and shoulder pain, is because most adults sleep on their left side. So the left shoulder is on the bed. The left shoulder and the left chest
It's resting on the bed.
is resting on the bed. So there is a compression of the left chest and shoulder. In addition to that, if the pillow is low, then the neck is bent at an angle, just like this. So that causes a lot of pain on the left side, the shoulder and the chest. So there are various sleeping techniques, very simple hacks to relieve that pain of that left shoulder and chest. So most of the chest pain, a lot of chest pain and tightness that people experience, especially when they get up in the morning, is related to the sleep posture. So that's one common reason. The second reason is our work posture when we are on the desk. So most of us are desktop workers, right? So it again has to do with our position. So if the chair is not ergonomically designed, which means if your shoulders are up like this or down like this, that again puts pressure on the shoulder. So generally it's the left shoulder which is at rest and in a fixed position for a long time. Right hand is always moving on the keyboard. So there's no tightness on the right side. Again, it's the left side. So you may be in a stressful situation at your workplace and you're doing all your work. You've not realized that your chest was in this position. You're tight from your work-related tension, so your muscles are tight. And let's say you decide to take a break after 45 minutes or so. And when you just get up and start stretching, you immediately feel a pull on the left side. And you start thinking, is this chest pain related to underlying heart problem? And the minute that thought enters your head, your heart rate starts increasing. This becomes a vicious cycle. You suddenly start hyperventilating, which means more breaths in and out. That washes out carbon dioxide from your bloodstream and you start feeling dizzy. Now you have chest pain, a high heart rate, and you're feeling dizzy. You reach out to your nearest friend, complaining that you have chest pain. You're sweating because your adrenaline levels are high now, and you're feeling dizzy as well. So the immediate thought is, well, he's getting a heart attack. Okay. So the first thing to do is to relax the person concerned. There's nothing else that you can do for the first 10 seconds. Just relax the person. People should give him space and air to breathe and ask him to just relax and spread his arms out. Within 15 seconds, once he relaxes, slow, shallow breathing and just relaxes and his chest pain disappears, that chest pain is not from an underlying heart attack. It was just the chest tightness and that inner fear that a doomsday scenario, something is happening to you, that results in a vicious cycle that will mimic a heart attack. And worst case scenario is this can suddenly precipitate into something.